internal bra is typically placement of mesh, either for support of the implant or support of the breast tissue during a breast lift procedure. I see quite a few patients who have had breast implants in the past, and they've either fallen to the side or fallen too low below the natural position of the breast crease or breast fold. We call that the inframammary fold. And it's also known as bottoming out. And that can be repaired. Very, very commonly in my practice, I see those types of patients who've had breast implants in the past. And one or both of these two circumstances have occurred. And they are repaired and then reinforced with a dissolvable mesh. There are a couple of brands of the dissolvable mesh that we use, and it's placed inside the breast to support the implant, and it helps to reinforce the repair that we've performed. The other circumstance where we might use mesh is in a woman who has sagging of the breasts, and we're doing a breast lift, and a piece of mesh is then used to support the breast tissue with the breast lift that's being performed. This is dissolvable mesh, usually lasts between 1 and 2 years, and some might ask, well, why use dissolvable mesh? It's going to wear out. Well, the purpose of it is to stimulate the production of collagen, i.e. scar tissue, in through the weaves of the mesh, so that the mesh is replaced by a supportive structure of your own tissue. Everyone forms scar tissue after any procedure. The mesh provides us an opportunity to control where the scar tissue forms in a way that supports either the breast tissue or the implant or both.